Well, that's a complicated question. I'm an old child and adolescent psychiatrist. When I was just starting out in training, it was probably 4 or 5 in 1,000 kids had an autism spectrum disorder. Over time, it's become 1 in 100. And now you see some statistics, the CDC says in the United States, and it's 1 in 44 kids has been diagnosed with autism. So that looks like a rise in rates. There have been changes to the diagnostic criteria over the course of years that may account for some of that. There may be improved recognition of autism spectrum disorders, particularly for kids who are less affected. If you think back 40 or 50 years ago, it was easy to identify kids who were nonverbal, engaging in repetitive behaviors, and really in their own world. To recognize that they had an autism spectrum disorder. But I think we moved to finding some of the kids who are less adversely affected. And so that has increased the recognition and increased the prevalence. There's also data that shows that for kids who were identified as intellectually disabled, there were services for them. But there were no services if you were identified with an autism spectrum disorder. So people would preferentially label them with the intellectual disability to access services. In the last 20, 30 years, there's been a better recognition that services are necessary for both kids and adults on the autism spectrum. And so you see a change in the primary diagnosis of an intellectual disability going to a primary diagnosis of an autism spectrum disorder because there were now services available, and that helped people to get those services. About half of kids with an autism spectrum disorder are intellectually disabled. So in that respect, I don't know if it's lowered the incidence of intellectual disability, but as a primary diagnosis, you've seen that sort of shift.
Visit us online at wqed.org/autism for more web extras, links to resources, and to watch the documentary Autism Aging Out,